Mandara on the panel later today. You're welcome once again, distinguished guests. And to take it up from here, I would invite the Director of Programs, Nigeria Health Watch, for a brief opening remark. Kemisola Abaoye, over to you. Thank you.
Hey, good morning, everyone. Thank you so much for joining this webinar. And thank you, Kachi and Oscar, for starting us off and for an excellent introduction. I'd also like to say thank you to our distinguished panelists. Thank you for making the time to discuss this very important issue, the new administration's health agenda. Nigeria is projected to become the third most populous country in the world by 2050. And right now, our health indices are quite poor. So for example, maternal mortality rate is at 512 women per 100,000. Our child mortality rates, for children under 5, 1 in 10 children under 5 die before their 5th birthdays. I could go on and on about the health indices, but believe it or not, there has been some improvement actually. There are some things that Nigeria is doing right. So for example, the recently conducted joint external evaluation of the health security infrastructure or architecture of Nigeria brought us up from 39% in 2017 to 54% now. This is a 15% increase. And this is as a result of sustained investments in health security. So for example, investments in expanding the public health laboratory network in Nigeria has significantly improved health access to emergency healthcare services during outbreaks. Nigeria battles a number of outbreaks every year. Every year we have cholera, Lassa fever, and meningitis outbreaks right here in Nigeria. And the federal government and its ministries, parastatals, and departments have increasingly invested in manpower, equipment, and infrastructure to beat this. We still have gaps in primary healthcare. Health financing has quite a long way to go. We have never met the 15% target set by the Abuja Declaration, maybe 5% or just higher than 5% for the federal budget. So there is quite a ways to go. Out-of-pocket expenditure is still over 70% for Nigerians. And these all point to what the gaps are. I'm mentioning numbers right now, but there are personal experiences that people can share and people can relate to. For example, a friend of mine lost his son last week. And I'm still processing that because when I listened to the story, it did seem like there were gaps in our healthcare system that could have made that death preventable. So I've talked about indices, I've talked about the numbers, we have personal experiences to share as well, but enough about the woes, enough about the challenges. What needs to be done right now? The new administration was sworn in about 100 days ago, and the health agenda of this administration was clear. It included expanding access to health insurance, which is really important. Strengthening the health workforce. We know what the brain drain is doing to the health sector in Nigeria. And while I am really optimistic about the agenda that was set and about the structures and the changes that are happening and the people that are being put in place to effect these changes, it is important that we have discussions about what evidence-based ways these gaps need to be bridged. On this webinar today, we have people from academia. We have Professor Obinna and Professor Morenike, who are established academics in health. They are also clinical practitioners. Kachi will tell you a lot more about them later. We also have the special advisor to the President on Health. This is the first of such appointments in the Nigerian government. And this is someone who has years of experience across sectors, both public, private. She served as a commissioner for health in one of the most challenging regions in the country. We know about the security challenges that we experience in the Northeast. You're going to be hearing from her. You're also going to be hearing from Dr. Myron Mandara, who also has extensive experience across both public and private sectors and is a clinician as well. We're going to be looking at the health agenda that government has set. We're also going to be examining the evidence. What exactly should they prioritize, especially in the immediate term and in the intermediate term? What are the quick gains that need to happen to strengthen our health sector and our health systems and improve the quality of life, improve our health indices, and make it a lot more difficult for preventable deaths to happen? That's what we're here to discuss. When the Conversation Africa reached out to us to partner together to host this webinar, there was no second thought. I did not think about it twice. It was a no-brainer that this is a conversation that needs to happen. I am looking forward to it. Thank you so much, everyone, for joining. And thank you once again to our distinguished speakers and to the Conversation Africa. We're really excited to be partnering with you on this. And I look forward to fruitful and insightful deliberations. Over to you, Kachi.
Okay, so it's actually, I will be taking over. Kachi is well, she's prepping for something really, really special. But thank you so much, Kemisola, for that. For those who just joined, great to have you with us this morning. That was Kemisola, the Director of Programs, Nigeria Health Watch. Thanks for the overview and framing our conversation today. We're waiting for others to join just to make sure we have good numbers, and we do have some good numbers. We're nearing 100 now, and we're still expecting some more. Before I introduce our distinguished keynote speaker this morning, I just want to have some quick house rules since we're a good number now, some housekeeping rules. So please, first of all, do ensure you mute your microphones for our participants. For those who will be speaking, would appreciate if you could have your camera on. And now this next one is very important. It sounds funny, but it has happened a lot of times. If for whatever reason you do happen to go to the convenience, please ensure you do mute your microphone. I've been in one or two meetings where well, let's just say I heard what I was not supposed to hear. We wouldn't want that to happen today. So please do ensure we have that decorum as well. So from a lighter note, it's time for us to move on very quickly. For those on social media, I would appreciate if you could also use our hashtag for today, which is Health for All Naija. That's hashtag health for, that's number 4, all Naija, Health for All Naija. I'll reiterate that and drop that as well in the chat room. Questions can be dropped when it's time for our Q&A. So as soon as you join, if there's anything you feel you would like to ask, just jot it down. And when the time comes, you can paste it in the chat room. And myself and Kachi will come through and see if we can address as many of the questions. This event is being live streamed on the Conversation Africa's Facebook page. So feel free to share the link to other friends as well. So on that note, it is my great pleasure and honor to introduce our keynote speaker. She is the Special Advisor on Health to President Bola Tinubu, the first of its kind, if I can put that way, like Kemi rightly said. She has over 25 years of experience in the health sector development, health sector policy formulation, strategic development, resource mobilization, and implementation of health programs at the international, regional, and national levels. She has been a 2-time Honorable Commissioner for Health in her state, that's Borno, and we all know how challenging that must have been for her, like Kemi rightly said, and we do salute her, and we're very happy that she's alive, and of course she's here with us as well. Many awards to her name, and of course notable is being the best performing commissioner in the Northeast on polio eradication. And we are excited to have her here with us. Ladies and gentlemen, it's a great honor. I know you can't physically clap, but if the camera is in front of you, just signify by doing this. And if you're in the chat room, use any of the emojis that comes to mind as we welcome Dr. Salma Anas, the Special Advisor on Health to President Bola Tinubu. Thank you very much for being here, ma. How are you? Okay, you need to unmute your, yes.
Yes, thank you so much, Kachi. It's a great pleasure to be with you all today. Thank you.
Okay. So this is Oscar speaking. Kachi, where is Kachi?
Okay, where is Kachi? This is Oscar.
Well, for you, ma.
Yes, Kachi, I've been communicating with her, so it's all right, Oscar.
Well, for today, I can be your Kachi, if that's okay with you.
Kachi is right here, Oscar.
You're welcome. Thank you.
Okay,
Good
Kachi is
morning once
there.
again, ma.
Yes.
How are you feeling? How are you feeling this morning?
Fine, thank you. I'm okay. I'm great today. Thank you so much.
So first of all, congratulations on the new office. I know it's still early days, but if morning shows the day, judging by your track record, we're excited for what the future holds in your office. We wish you all the best. And without taking too much of your time, I'll cede the floor to you for your keynote address. Thank you once again for being here.
Thank you so much. It's a great pleasure to be with all of you. Let me start by acknowledging the organizers of this very important interaction, the dialogue, organized by the Nigeria Health Watch on Nigeria's new administration setting health agenda. I want to sincerely appreciate the Nigeria Health Watch and all the team that have put together in collaboration with all your relevant partners. I also want to acknowledge my colleague who is here, a member of the Presidential Advisory Committee, distinguished Senator Ibrahim Olorugbe, whom we have worked very closely in the past 3 months to put the agenda that we are discussing today. I also want to welcome all participants that are in this meeting, both online and also on the social media. A very good morning to you all. It gives me a great pleasure to give this keynote address on this platform to discuss the health agenda for this administration under the leadership of President Bola Ahmed Tinubu, GCFR, who is also the current president of the Federal Republic of Nigeria. To me, this is a very important dialogue taking place at the right time. As was rightly mentioned by the previous speaker, this administration is just about to mark its 100 days in office, which is 3 months already, commencing with the implementation of the Renewed Hope Health Agenda. We are indeed witnessing another significant landmark in the history of our dear country, Nigeria. And this is a great opportunity for all of us to be witnessing this period of time in Nigeria. So the previous speaker, the first speaker, Kemi, has clearly put the situation of the health in Nigeria. So I don't need to go over it again. But if I can summarize, I can say that it's not so good. We're making very, very slow progress, over a long period of time. And in some areas, if you take the newborn, we are not even making progress. We are almost stagnated or non-progress, as the trend remained the same, despite all efforts. And we have witnessed significant efforts in the past few years, if we take the last 10 years, either by government at the national level or at the sub-national level, and huge investments by our development partners, donors, and all relevant stakeholders, including the individuals and philanthropists. But unfortunately, it has not given us the desirable results. So what is wrong? And how do we address this? And these are the questions that we ask ourselves. So please permit me, ladies and gentlemen, to go back and just talk about how we came about it, because things were done differently. And this came about as a result of, to inform you about how we went about setting up the health agenda for Nigeria, for this administration. So it's all started because of our concerns. And I would say concerned experts came together, worried about the indices, and then the huge investment that is not yielding results. And we say, what do we do differently? And under what we call the Health Transformation Coalition, which we started early this year, I think late last year, we started talking about it. And then we felt, how do we should start talking to people out of the cycle of the health sectors. because what we have done, we felt wrongly, is we have been communicating among ourselves as technocrats, as health experts, as health workers working within that space of health work. We need to go out and break barriers and talk to people and do things differently and come up with an agenda that will be all inclusive. So that was the beginning of it. And we felt also the politics was hitting that time before the election. And we felt it was the right time also to talk to politicians because they have a bigger responsibility of making commitments and moving the agenda forward. So we started interacting with political parties and then aspirants of different political parties. So deliberate efforts was made to ensure inclusion of health in the political agenda, far beyond the past experiences where we have uncoordinated approach, uninformed approach to healthcare delivery and commitments of the agenda. So a lot happened even before the election. We had several engagements with relevant stakeholders at that time. And then we reviewed the health agenda of the past and then what went wrong in terms of implementation of those agenda. And we articulated all those information and we used them for advocacy and engagement with the political aspirants and different political parties. So accordingly, the need to prioritize the health sector was necessary, even before the last election, to engage political parties when presidential aspirants emerge. We reviewed previous reform documents. Several reforms have happened in Nigeria. And you can see that we have so many beautiful reform documents that has happened in more than 20 years. So we reviewed a lot of them. And also the most recent health sector reform document was also reviewed. We reviewed a lot of policies and strategic documents, including the existing national health policy, the National Health Strategic Development Plan 2, which is undergoing a transformation now to become either an abridged version before they develop the 3, and several other strategic documents, guidelines, policy briefs, were also, we engage with different stakeholders, those in diaspora, health workers, we also engage with them, and the government officials. We had 3 major town hall meetings in the country. Two was held in Lagos, and then one was held in 2 in Abuja, and then another one was held in Kano with different categories of health worker, so as to align campaign promises with global standard practices, unlike what we used to have in the past, as I said. So this happened for the very first time in Nigeria, where there was such seriousness given to developing a health agenda, even before the emergence of a president in a country. And it was well thought through health agenda, which was also used to guide the manifestos. So this set the stage for prioritizing health as a major health agenda item for this administration and a platform for national growth and development. As the president will always say, health is critical for development and economic growth. Subsequently, the Presidential Advisory Committee was established, and there was a subcommittee to it on health. I happen to chair that subcommittee on health with reputable health experts as members, representing government, private sector, diaspora, and legislation. Distinguished Senator Olorugbe is a member of that subcommittee, and he made very valuable contributions. The renewed health policy agenda was developed. That was the outcome of that subcommittee, which was adopted and endorsed by Mr. President. It is gladdening for me in all that we have done today to mention that the President, Bola Ahmed Tinubu, has clearly demonstrated highest level political commitment to health because he listens and he wanted to know more about health because he strongly believed that without health, we cannot achieve any meaningful economic development and social development. So through that, I think we are happy and we are very lucky to have such a leader at this critical time. And as you have said, Oscar, you are not Kachi now. I remember the name very well. I won't make that mistake again. So as you said, Kachi, this is the first time in Nigeria we are having, in the history of our country, that we are having an establishment, an office for the Special Advisor of Health, which is of additional value to the structure that already exists in the country. Ladies and gentlemen, distinguished participants, having recognized the magnitude of the problems which were clearly indicated by Kemi earlier on, we felt there is need for this administration to remain very committed and demonstrate high level of commitment and sustain it to fast track reversal of the ugly trend. Thus, the renewed hope policy agenda on health becomes critical for implementation to put Nigeria on the right track towards realization and harnessing of our potentials. So that is the renewed hope health agenda. I will briefly talk about it in a few minutes. The renewed hope agenda is aimed to attain health for all through an efficient and effective universal healthcare coverage system using the continuum model as contained in the Sustainable Development Goals, which we are all committed to. This administration, ably led by His Excellency, President Bola Ahmed Tinubu, strongly believes that Nigerians deserve quality and it's impossible to make this a reality. These are his own words. So the overall goal is to move Nigeria closer to the universal healthcare coverage aspirations, with a key focus to reduce the gap. You have a huge gap, is to reduce the gaps between those that are in need and the use of services. As we all know, a lot of evidence have shown us that quality of services are very, very poor, especially at the primary healthcare level and also the unregulated private sector, where majority of Nigerians access services. We are also planning, the whole goal also is to ensure that we reduce the overall, we provide overall financial protection for Nigerians because majority are vulnerable people. These actions are aimed to improve the health status of all Nigerians as judged by their impact on the population's health outcomes. And secondarily, by their impact on improving the health sector's performance along the dimension of efficiency, equity, quality, and sustainability. And I believe other speakers will talk to those indicators later on today. The renewed health agenda offers several laudable changes to the health systems, including a material increase in public health financing, which prioritizes the poor and vulnerable people, through an increase in subsidies to achieve UHC, to achieve universal insurance coverage, and an expansion of the public-private primary health facilities, both public and private, and also to ensure that new funding translates to tangible benefits, because this is another critical area. The funding we are receiving, are they being judiciously utilized that translate to tangible benefits? Nigerians need to adopt policies that aim at improving efficiency and quality. Thus, the agenda is based on 3 fundamental tenets: strong government in health, participation in health, and a role in health, and also commitment to equity and scale up of private sector participation in health. So the relevant components, at the end of the day, we came up with 8 thematic areas as key priority areas, though they are not exhaustive, but those are the key areas of that needs to be focused on. There are so much to be done, but we also need to prioritize, as I discussed, as was mentioned by the new minister of coordinating minister of health. So first is about health governance, leadership, and institutional reform for the health sector, which makes it more responsive and accountable with proper coordination and alignment mechanisms. This is to avert the experiences of the past where we have silos, fragmentation, and uncoordinated approach in our implementation of activities. So this should happen across all sectors, both political and institutional commitment. Thus, the new role of the new Minister of Health, you can all adjust to that, is called the Coordinating Minister. This is the first time we are attaching that to the Honorable Minister of Health. He's not just a minister, but a coordinating minister, because one key weaknesses that came during our consultation and stakeholder engagement was ineffective coordination at all levels, at the national level, worst at the subnational level. Ineffective coordination within the ministries of health, between the ministries of health and its parastatals. Ineffective coordination of the support given by all our donor partners. This remains a key challenge. So we are happy today, and this is another key demonstration, a significant demonstration of commitment of the president himself, by appointing a coordinating minister of health in the name of Dr. Pate, who will work very well and ensure that issues around uncoordination and fragmentation are addressed in the country. And this will effectively maximize utilization of our scarce resources. So second to that, Prof is here, Obinna Onwuchekwe, the expert on health financing. You know, I like to listen to you, sir, when you talk about health financing. It's so interesting. But the major bottleneck has been implementation and realization of all the talks. So it also comes as our second critical area through where we suggested the need for increased budgetary allocations to high impact health interventions. Nigerians have piloted several high impact projects that have worked. We don't need to reinvent the wheel. We need to move on to implement those high impact projects that will give us results. Increase in the national insurance coverage to cover at least 40% of the population that will be augmented by the Basic Healthcare Provision Fund and the Vulnerable Group Fund. Studies have shown us that the Nigerians have almost 60% and above of vulnerable people. And there is a register that does exist at the moment. And then we also need to look at different and innovative approaches. I will not go into detail of them. We have a finance expert that will talk more about it. You know, increasing the physical space for health service delivery, and then using different avenues. A lot of discussions are currently ongoing on earmarking the sugar sweetened beverage tax and other pro-health taxes, telecom, and several others. After the advocacy, what we need to ensure is to ensure that those funds are dedicated or significantly dedicated to health intervention programs. And then improving Nigeria's largest infrastructure renewal project by deepening current public-private sector investments and positioning the National Health Insurance Authority for better performance as the key pooling entity in the health sector. So health financials remain very critical, but at the same time, the challenge to us also as health workers is to improve the absorptive capacity to utilize the resources in a very transparent and accountable manner. And that also remains a challenge. And those are the areas that must be focused on and addressed so that resources yield the desirable results. Another area that this administration is focusing is the delivery of integrated, comprehensive healthcare services. Nigeria has 3 tiers of services: primary, secondary, and tertiary institutions. Unfortunately, all are not connected. There are no linkages between them. So there is need to have an integrated healthcare delivery where the primary healthcare will be repositioned and strengthened to be the bedrock and fulcrum of the healthcare delivery system, having 80% of Nigerians' government investment in the health sector through adequate financing and infrastructure, appropriate services, including skilled human resources sensitive to the needs of the people, with established referral structure to secondary and tertiary level. We want to see that the tertiary facilities are adding value and strengthen systems at subnational level through capacity building, through mentorship, through quality delivery of quality healthcare services. They are there to help with provision of the hands-on experience to the primary healthcare level, as well as also the secondary level of care. And then, of course, we cannot leave behind the aspect of preventive healthcare services. As the saying goes, prevention is better than cure. Vaccinations will be strengthened, and routine immunization, not a focused immunization of polio alone or diseases of high priorities, but all scope of routine immunization, and then non-communicable disease screening, and then the geriatric care and for early detection and rehabilitation of diseases. Another burning area that this administration is committed to address is the area of human resources for health. There is need to close that gaps between human resources, and then there will be massive deployment of efforts to ensure that within the workspace, especially at primary healthcare levels, incentives are made available to achieve performance-based remuneration and proper training of the requisite health workforce, which includes skill mix and also task shifting. The task shifting document and the task sharing document have always been in place for several years, but operationalization remained a key challenge due to several factors, including unnecessary conflicts, professional rivalries between among health workers. So those are areas that need to be well coordinated and addressed. The effort is to see at the end of the day, we also address the issue of the brain drain and reverse it to a brain gain through increasement of the stock of health workers and also incentivization, motivation, and also improving the workplaces for health workers, especially giving them capabilities to be able to deliver quality healthcare services to all Nigerians. Another area that we've looked at also is an area of local manufacture. As we all know, the previous administration, one of the key area, the executive order that was released was about local content, but not much effort has been put in place to realize that in the health sector. So there is need to improve investment environment and access to funding, especially for originators of original manufacturers of medical equipment. Big pharmaceutical manufacturers should be attracted, and other private sectors. And this is an area where private sector will play a critical role in production and manufacture in country, and also provide an improvement and implement establishment of medical manufacturing industrial areas with prioritization of secondary factors of production to improve the ease of doing business in medical. We've learned and we have seen the impact of COVID, where even access to protective personal equipment was a key challenge in Nigeria, where countries are protecting themselves. And so Nigeria needs to be self-reliant in local production. And this is an area that we're going to work assiduously to strengthen partnership with the private sector. It has happened in several countries. One of the success stories we have seen is also in India. So there are lots of lessons to learn and also quickly replicate in our own context in Nigeria. Still drawing from lessons of COVID, we have also seen the huge weaknesses, in the areas of our response. So that gives us an opportunity to strengthen our public health emergency preparedness and response mechanisms based on all the peculiarities of country experiences and our personal experience, as I said earlier, with COVID-19 pandemic, and also a control of other epidemic diseases. It is sad and unfortunate to witness that Nigeria is currently witnessing a diphtheria outbreak in major cities like Kano, Abuja, and even in Lagos. There were pockets of outbreak. So that is an indication of a weak health system, not just a weak health system, but it is a true indication of poor coverage of immunization, that a lot of those that are supposed to be vaccinated were not able to access vaccines due to several reasons, either denial or several others. So those are areas that we need to do more in terms of strengthening our mechanism and also adoption of global best practices in health security initiatives that will guard and protect population. So we are happy today we have a minister that is an expert in public health, not just an expert, he's an expert in public emergencies and response preparedness, and also in immunization activities. So we look forward to working with everyone to be able to achieve that success, and also to address biosecurity legislations. I will not go into too much details, but another area or two that I think I should mention before leaving is on health information management technologies. We need to deploy and have a centralized system whereby with the modern technology, we can have access to gathering to information that we can use that will inform our policies and also program implementation. We can also deploy technology to deliver smart health services and several other interventions in our communities. So these are some of the few areas that I will highlight because of time constraints. But I must mention that this health agenda of President Bola Ahmed Tinubu is a whole of system and a whole of government approach perspective, targeting the social determinants of health, where health will be in all policies beyond the health sector towards an attainment of UHC. So the coordination role will be beyond the health sector, working with different relevant sectors that contribute in terms of addressing some of the determinants of health. The health needs of the citizens of this country, ladies and gentlemen, are therefore prioritized as a fundamental human right and a matter of national security, which the government shall greatly invest in the national growth, development, and sustainable prosperity. The agenda is obviously looks very ambitious, and a lot of people will say it's ambitious. We would prioritize, but we need to jumpstart and start implementation, which we have already started doing so. It will require, government alone cannot do it. It requires collective efforts for everyone, each and every one of us at national, more so at the subnational level and up to the local government level, including all players to participate in it. So with this, I will say that I look forward to the outcome of this very important dialogue coming at the right time, as it will further give us insights and recommendations that we would use in further shaping the administration's commitment towards building a resilient health system that will put Nigeria in the path to attain our UHC aspirations, where all Nigerians, irrespective of socioeconomic status, gender, or disability issues, will have equitable access to quality healthcare services within their reach. So I must stop here. I hope I have not taken so much of your time, but it's a desire to share, and I'm going to share some of these documents with Health Watch for further dissemination, and we look forward to additional inputs from all our key players and key stakeholders. Before I end, I must once more appreciate the organizers, especially Nigerian Health Watch, for the support that they've been given to the health sector, not just as a watch to the health sector and monitor, but also implementation of programs, being an advocate for the health sector. I personally cherish that relationship, and since the beginning of Nigerian Health Watch, and I continue to appreciate Vivian for the good work she's doing and her team. Thank you so much. Thank you for listening and for the opportunity.
Thank you so much, Ma. So you've just heard from our keynote speaker, Dr. Salma Ibrahim Anas, the first Special Advisor on Health to Mr. President. Thank you, Ma, for that succinct overview, and of course, laying the foundation for our panel session on Nigeria's new administration setting the health agenda. The theme, of course, today is the same, which is Nigeria's new administration setting the health agenda, and it's brought to you by Nigeria Health Watch and Conversation Africa. The hashtag is still Health for All Naija. That's health for, that's number 4, All Naija. Thank you again to each and every one of you that have just joined. The numbers have, I think they've doubled now, which is a good affirmation that we have. Now, we have quite a lot to discuss today, but the first thing, which is the most important thing, is the panel session. Idris and Matthias, I see you. I see you've already put up your questions, which is very nice, but the time for the Q&A will be communicated, and we'll have that after the panel session. My co-moderator is also here, Kachi, and I will hand over to her to welcome our first panelist this morning. Kachi, over to you.
Thank you, Oscar, and thank you, our distinguished keynote speaker, Dr. Salma Ibrahim Anas, for that extensive and heartwarming keynote speech, which is expectant. There's so much expectations for the health sector. We know we are not this close to achieving universal health coverage, but if the health sector is prioritized by this new administration, then we can make more progress in terms of achieving universal health coverage. So once again, we would say many, many thanks for honoring this invitation and for pouring it all out to the guests. And I believe that this keynote speech is going to catalyze a very brilliant discussion from our panelists, who are all set to delve into the discussion of the setting of the health agenda for this new administration. So I'll quickly move to the introductions. I have First on my list, distinguished Senator Oloriegbe. He is a Nigerian medical doctor, politician, and philanthropist, and has practiced as a clinician in the Nigerian health sector since 1985. He has worked in both the public and private sectors and was a majority leader at the Kwara State House of Assembly. He was also elected senator for Kwara Central Senatorial District in 2019. He was chairman, Senate Committee on Health for the 9th Assembly. You're welcome, Senator Ibrahim Oloriegbe. Thank you for joining us this morning.
Thank you very much, Kachi. It's my pleasure. Thank you very much, all participants in this very important webinar. Thank you. So over to you, Kachi. Are you asking a question or is it okay?
Okay,
no,
so we'll have the introductions for all the panelists, and then we'll come with the first questions in that order. Thank you.
Okay, over.
So Oscar?
Thank you very much, Kachi. Our next panelist is from the University of Nigeria, Nsukka, currently a professor of health economics and policy and the pharmacoeconomics, epidemiology in the departments of health administration and management and pharmacology and therapeutics, College of Medicine, University of Nigeria. He is one of the leading health economists and health financing experts in Africa. He was a member of the National Healthcare Financing Policy technical group that produced the first Nigerian healthcare financing policy, was the lead facilitator of the Nigerian Presidential Summit on Universal Health Coverage, and is currently the co-chairman of the National Technical Working Group on Health Financing and Equity. He's also the co-chairman of the Scientific Committee of the African Health Economics and Policy Association and the technical facilitator to the ongoing efforts to produce a new national health policy for Nigeria. Judging by his bio, you wonder if he gets any sleep whatsoever, but thankfully he's here with us. Please do make welcome Professor Obinna Onyejukwe from the University of Nigeria. Thank you so much for being here, sir.
Our next introductions will be for Dr. Mario Mandara. Dr. Mario Mandara is an obstetrician gynecologist and public health physician with extensive knowledge and experience in strategic planning and implementation of health and social transformation initiatives. She is the founder and board chair of Girl Child Concerns, an NGO dedicated to improving the lives of women and girls through providing educational opportunities, life skills, and income generation. She served as a member of the United Nations Secretary General's Advisory Group on Central Emergency Response Fund that helps to shape and continuously improve the performance of the UN Central Emergency Response Fund. She's currently the Chief Advisor and Coordinator, Sustainable Development Partnerships and Humanitarian Support. Thank you very much, Dr. Mario, for joining us this morning. We're glad to have you.
Thank you very much, Kachi, and good morning, everybody, and greetings from the village of Shani in southern Borno, in southern part of Borno. I look forward to participating in this very important webinar.
Thank you very much. Thank you very much, ma. I look forward to coming to the village as well. And of course, we have with us Professor Morenike Folayan, a professor of pediatric dentistry at the Obafemi Awolowo University, Ile-Ife in Osun State, Nigeria. She holds a master's in business administration and another in education administration and leadership. She also holds a fellowship of the West African College of Surgeons and belongs to various professional organizations. She's being a beneficiary of various national and international research and project grants, and has had several, in various capacities, multiple national and international associations, committees, projects, and as a peer reviewer for many high impact factor health related journals. She has authored and edited more than 15 books, and book chapters and has over 210 journal publications. She has a history of working with the community for the community to enhance the voices of stigmatized and vulnerable populations. And she is here to lend her voice to this panel discussion. Professor Morenike, great to have you with us. Good morning. Professor Morenike, can you hear us?
Yes, I can. I apologize for my muted mic. It's indeed a pleasure to be here, and yes, really looking forward to this interesting panels that you brought together. And congratulations to Dr. Salma, as well as, everything you've done in the past, bringing it to this administration. Congratulations. Thank you.
Thank you very much, ma'am. So, Kachi?
Yes, thank you, Professor Morenike. So we'll move straight to the questions to our guests. Please drop your questions in the Q&A chat box with an introduction. Just your name, your organization, and your questions. The panelists will attend to the questions right at the end of this discussion session. So my first question will be to distinguished Senator Ibrahim Oloriegbe. Sir, you were key in passing a few public health or some public health laws during your tenure as the past chairman of the Senate Committee on Health for the 9th Assembly. Some of the laws include the National Health Insurance Authority Act, but the Buhari administration did not pass some laws before transitioning into this new administration, transitioning into this new government. Some of them are the Public Health Emergency Bill and the Maternal and Perinatal Death Surveillance Response Bill. And we know the Public Health Emergency Bill, if passed into law, will strengthen the health security architecture of the nation, as well as the NPDSR bill, which will contribute to the improvement in maternal health outcomes. So what are your thoughts on this administration's focus? What should they focus on to get quick gains in legislating for improved health outcomes? Thank you.
Thank you very much. I think I'll be speaking with two caps on. As the keynote speaker said, I have the privilege of being a member of the Presidential Advisory Council Head Subcommittee. So as such, most of what I will say is not my personal thought, but it will be what I'll say collective thought of that committee as to what we have recommended and what we hope. And we are working together to see that this administration do. Now, I think the question has put forward about three different aspects, so that I will handle them one by one. And I want to start with the issue of health financing, the National Health Act. National Health Act amendment has two parts. In that particular, the bill that was passed by the 9th Assembly. It has the part that is proposing an increase of the 1% consolidated revenue fund to 2%, and as well as specifically clarifying the allocation of the 5% of the 1% of what will be the 2% later to public health emergency and the what I will call other emergencies. That is the emergencies that are from injuries and so on, because it was not clarified there. And the NCDC Act also had an error. So those are the two critical things. We have recommended under the PAC, one of the things we want this administration to do is to adopt that, especially as the administration has made a commitment to increase funding to health. And we say one of those areas of increasing funding to health, particularly to achieving the putting 50 million Nigerians into health insurance, would be for federal government to increase its own component of the basic healthcare provision fund to 2%. And we felt one of the best, government cannot do that by fiat except by the law. So the new administrations, one of the things that we hope will be done is that bill will no more be a bill which was a private member bill, which I had the privilege of sponsoring, but the executive will own it and commit itself to that. On the issue of the maternal perinatal surveillance bill is also part of the core commitment that we put forward to the administration. And I'm sure Dr. Salma spoke to that also. Because one of the key things we were expecting that we recommended is the commitment of the president on reducing maternal mortality and infant and child mortality. That is to make every child to count and every woman to count in terms of healthcare. So part of that will be the issue of the maternal death review, maternal death audit, and issue of data. So that's also a recommendation that we hope that the executive will own it. And I will come to the end of why executive should own a bill and what's the difference when it's executive that is pushing a bill and which is a private member bill. On the public health emergencies bill, I was a little bit sad because I made a public commitment either through a webinar and even through a conference hosted by this Nigeria Health Watch on particularly public health emergency control of infectious disease. On our part, I was able to fulfill that commitment. We were able to pass a consolidated bill, both houses, both the House of Rep and the Senate, because I had the privilege then of being the chairman of the conference committee that considered the various versions passed. And we presented the report in both chambers. But unfortunately, it was communicated. The former president did not sign. The new president, it wasn't one of the bill that was signed also. I think it is one of the low-hanging fruits that this administration can quickly turn around. But unfortunately, it won't be that they can sign what has been passed, because by virtue of our procedures, those laws are staying now, so they have to go back through processing. But I'll come back to that. But the other three public health emergency bills, the NCDC Amendment Bill, the Quarantine Act Repeal and Reenactment, and the Animal Disease Control Act. There's also one, which is something that is dealing with sport health, which were presented. So it should be about 5 bills. My view would be that we need, this new administration, we need to relook at all those bills and consolidate them instead of having fragmentation. Particularly, we have to look at how we address public health emergency now. The bills were separated because of various input that came, because initially it was the Quarantine Act that was supposed to be amended to incorporate the public health emergencies, but there were issues that were raised there. And if you look at the public health emergency and the NDDC Act, I'm of the view now that with hindsight that we can consolidate and have one bill. And what this administration would be is to look at what is our architecture or the structure to address public health emergency. So on these three various issues, that's the National Health Act on one part, the maternal and these other bills, as I said, this administration will have to own them by the fact that the executive arm of government should present this bill back to the National Assembly. A bill presented by the executive is given much more priority than a private member bill, and is fast-tracked in terms of its processing by the Assembly. So as such, I hope it's one of those things our committee will be handing over to the ministers. The ministers should fast-track in presenting it to the FEC for FEC to approve, because for a bill to come from the executive has to go through FEC. However, I have an alternative suggestion also, because I have experience in the system. If the process of executive owning it will delay, I think we can work with the National Assembly Health Committee leadership. And this process has started. We have had an engagement with all the 7, because now the committees we have in the National Assembly are 7, 5 in the House of Rep and 2 in the Senate who are in charge of health. So I think as stakeholders and partners, we can work with those leadership, that is the chairman of the committees, for them to have a better understanding of this outstanding bill and present it and work on it fast. What will be advantageous is that working together with them, the bill may not necessarily require to go through public hearing again. The committee, because they have been passed before, so the members can present there, they will go fast through first and second reading, and they can adopt the report that was prepared before. So the executive role in that particular aspect, that will be, because they are already committed to it and they have made input, they will not raise objection when it's presented to the president for assent. So we can use these 2 methods to be able to align with that. But the final point will be that it's critical for the new administration to look at this, particularly the National Health Act amendment will enable the administration to rapidly increase allocation to health, particularly from 2024 budget. This needs to happen before the budget, which I hope will be presented by latest by October to National Assembly. So between now and October, or latest before the budget is passed in December, the National Health Act amendment ought to be passed by and signed by the president, so that we enable the president in 2024 allocation to have 2% of consolidated revenue of federal government to go for this. Of course, there are other things that the committee went beyond that. And but I'm sure, I don't know whether the planner has mentioned it in our presentation. Part of the thing committee is doing is engaging with the governors forum to see how the governors, the states, that is sub-national level, increase their resources and allocation. I had the privilege with her to have our presentation with the governors. They show commitment to it, and there's further work to be done. But part of what we are doing with the government is not only about their increasing the allocation from 1% to 2%, but we are looking at how they can make a commitment for the deduction that is meant for her to be like that of education, which is for it to be deducted from source. Of course, but the resources we have to go back to the state for them to use with a better guideline. The last point I want to make on this before I yield the floor will be that the committee went beyond these laws, particularly the National Health Act. It's not only about resource increase, and I'm sure the discussion will come on this. I'm happy that we have my colleagues, the professor of health financing from Enugu here. One of the things we look at is not only allocation and not only release, but efficiency in terms of use of resources, particularly at the state level and even at the national level. When these resources are allocated and they are made available, are we using them efficiently? This committee, that's the PAC committee, recognizes this and makes some recommendations, which we hope the administration will put to use to increase efficiency in the utilization of resources that are allocated for health. Thank you. Over to you.
Thank you, distinguished Senator. I think it's a good time to welcome Professor Obinna to the floor. Oscar, please take it away.
All right, thank you. Thank you once again, Senator Ibrahim. Thank you so much. Professor Obinna, how are you?
I'm all right. Hi, Oscar.
Okay, there you are. Just making sure you're there. Great to have you with us.
Thank you.
So you, sir, are the technical facilitator to the ongoing efforts to produce a new national health policy for Nigeria. And President Tinubu has issued his 8-point agenda: food security, ending poverty, economic growth and job creation, access to capital, improving security, improving the playing field on which people and particularly companies operate, rule of law, and last but not the least, fighting corruption. As you notice, health does not feature on this list, definitely. But we've also heard from Dr. Salma in her keynote address earlier on that there's a significant plan in place. Now, one thing that has not been discussed is corruption in the health sector. It's one of the 8-point agendas as a standalone, but I'm bringing it into the health sector. You've done a lot of work in this area. Do you believe there needs to be more of a focus on tackling health corruption?
Yes, well, before I start, I want to correct, I think you have an old bio of myself. That helping to develop national health policy was in 2016. So it's not, that was 7 years ago. So it's an old effort. I mean, the policy was finalized in 2016. So, I mean, to what you discussed about, or your question about corruption. Well, I think I just want to mention 2 key points, very practical points, which the presidential advisor talks about, and then distinguished Senator Oloriogbo also mentioned, this issue, which you find very passionate on, the Basic Healthcare Provision Fund, because within that one, we can talk about efficiency, accountability, and corruption. The system we have right now, the money that is released, just about 30% of it goes into service delivery. So even if we are talking about increasing it to 2%, but we maintain the same structure we have in currently implementing the Basic Care Provision Fund, you'll find out this money will also not be used efficiently. So I think one thing we've been discussing within so many fora, especially within the Health Sector Reform Coalition, is that the law and guidelines for the use of these basic healthcare provision fund should make it clear that at least 90% of the money should be used for service delivery. If it's not done, then it's still a waste, and because a lot of inefficiency is currently in place in the use of the fund. So I think it's something we're happy that this renewed Hope Health agenda, is talking about efficiency. So I think it's also important that we look into how to curb, make sure that the money actually works for the people. So I think that's going to be very important. Now, on the issue of corruption, well, I mean, it's a big issue, within our health system, and it manifests in so many ways. And many people may not know it, but corruption, absenteeism from work is a major form of corruption within the health system. And then, corruption is worse in the health system because it costs lives. When people don't go to work, or they go to work and they're not actually working, which we call presenteeism. So we have a lot of evidence on that. And then I think, I saw a part of the renewed health agenda is to make tertiary hospitals, primary healthcare facilities to, increase resourcing. But if we increase resourcing, but we don't tackle absenteeism, it will not achieve the expected impact. So I think we really need to go and see how we can tackle offers of corruption. The number one is absenteeism. Number two is also these politically connected people who are employed, who do not answer queries and who do not bring themselves to discipline. So I think even we've heard about massive employment is going to happen. If it's not done properly, transparently, merit-based, if you see political people just sending names and those people are employed and they never turn up to work, we'll still go back to square one. So, I mean, we don't even know how many people we have in work. We need a health research workforce registry that shows actually the number of people. And you'll be surprised that maybe we're even overstaffed. But the problem is that many people do not come to work and they disappear because they're connected and their godfathers and their godmothers will always protect them. So that's why I think this agenda that I saw, part of Renewed Hope policy agenda, that health is going to be mainstreamed in all sectors is very important. We've been shouting about that. So for me, it's wonderful because when we mainstream health in all sectors, of course, it means mainstreaming health within the security apparatus, within law enforcement. It will help to, not just attract resources, but also to make sure that rules are enforced and are not broken within the health sector. But I think because of want of time, and to give people more time to talk, I think we've heard a lot about, I think the Renewed Hope Health agenda is wonderful. So, but I think, in addition to circulating the agenda, I think these agendas should be developed into a strategic plan, which will show the hows on how to achieve the agenda. Because, for us who are into policy analysis, the hows are always the problem. It's very easy to make policy statements. It's very easy to, say, achieve this and achieve that. But the challenge always lies on the how do we achieve that, which I think a proper strategic plan for this Renewed Hope Health agenda will help. And then we think if that is done, then the strategic plan of the Renewed Hope Health agenda will also form the basis for the National Strategic Health Plan 3 that will soon be developed, as we try to achieve universal health coverage and then SDGs. But finally, I think we're wasting our time. We've mentioned a lot of things about we're not able to respond to COVID-19. We're not able to do this, but it's because our research infrastructure is weak. the country is not investing in research and development. So if you
okay, I think Professor Obinna should be back.
If we're not investing in research and development, we can't achieve anything. So we can keep saying all these things, but we need to move to evidence. On the Lancet Commission, which is also a recommendation that there should be a national health research commission, a medical research commission for Nigeria that should be funding research and development, because that is very weak in this country, and it will remain weak if we don't have. If we have to keep depending on international sources for research, we must have local resources that can quickly ramp up funding to meet our needs for COVID, and for all that. And then, finally, I want to mention presidential advisor, said something about working with the private sector to, empowering private sector to do a lot of things in Nigeria. And she mentioned some other country. Well, I want to remind us that in Nigeria, during the PTF area, Petroleum Trust Fund, the government actually partnered with local farmers to produce many drugs and many things, pharmaceuticals that were deployed in the system. So we even have some homegrown knowledge that we can tap on, while still looking outside. I think if we put all these things together, I think there's hope. I'm happy it's called Renewed Hope Health Agenda. I think there's hope that we can achieve, working together, achieve a better health system. But the weakness remains always the states. The federal cannot do it alone. The presidential advisor, the minister, they can have all the best design strategies agenda, but if the states are not on board and the local governments, we will not get anywhere. So we have to find a way as part of this governance of the Renewed Hope Agenda to find a way of benchmarking states, even if it's to produce scorecards. I regularly score the health system of all the states. And I think once we introduce that type of competition among states, I think it will help to bring states on board. And then with that, working together, we can achieve the Renewed Hope Health Agenda. Thank you very much.
Thank you. Thank you very much, Professor Obinna. I appreciate that. I know there's a lot to unpack in that particular question. But thank you for giving us the best version that you could, considering the time. Obviously, we can't address all the issues, but it's better we crawl in the right direction than run in the wrong one. Kachi, over to you.
Yeah, thank you, Oscar. And thank you so much, Professor Obinna, for your for the response that you have attempted to give to the questions. And I'll just say at this juncture that we have teaming questions in the Q&A box, and I can also see Senator Ibrahim Oloriegbe's hand up. Yes, we would give an opportunity to you to talk right after Dr. Mairo takes this next question. And also, we would also pick out some questions, and our panelists will attempt to respond to them. We're far pressed for time. Dr. Mandara, we have the problems have been elucidated. It has been established. We had the special advisor speak on weak health system. We had the professor also talk about the weak health system. And we know that inadequate accountability has been cited on many fronts as one of the key reasons for suboptimal investments in the health sector. You have served as a member of the past administration's Health Sector Reform Committee, and also as a member of the Tinubu Kashim Health Strategy team that made recommendations for this new administration's health agenda. So your unique position gives you a vantage point into the health sector. What key steps do you recommend must be taken to strengthen accountability mechanisms to successfully achieve the new administration's health agenda? Thank you, Dr. Mairo.
Thank you very much. And I apologize, I will not put on my camera because the network is very poor. As I said earlier, I'm somewhere between Shani and Yola. And first, I want to congratulate my sister, Dr. Salma, Dr. Anas, for enumerating the various aspirations of the current government in trying to strengthen our health system and make sure everybody has access to health. Primarily, for me, I will be speaking and looking at things not only as a public health physician, but primarily as a mother and somebody who is sitting with the people where over 70% of our population lie, and that is the poor. So if you look at strengthening any health system, accountability for any health system, what we need to look at what are those things that we should be held accountable for as health practitioners and as a government by at least 70% of people. And this 70% of people, literally none of us in this platform, or most of us in this platform, do not belong there. And these are the poor people. These are people living below $1.2 a day. And these are people who are living in very remote villages with hardly any water to drink. So for me, the most important area of accountability is in ensuring that we have a functional primary health care across this country. We have beautiful policies. Some of the policies we have in this country are some of the top-notch anywhere in the world. But what about accountability in terms of implementation of those policies? So in my opinion, if we hold ourselves accountable, if we have the government hold itself accountable, I'm so happy my sister, Dr. Salma, said the minister is a coordinating minister. If the coordinating minister can hold himself accountable and all primary healthcare systems accountable, I'm sure with minimal funding, our health systems will be improved. The policy we have is one functional primary healthcare per ward. Most of the causes of death in children is not malaria, it's not diarrhea, it's not pneumonia, it's malnutrition. How do we ensure we have a functional primary healthcare system that not only addresses basic healthcare as contained in the minimum healthcare package, but ensures equity, promotes disease prevention and health promotion? As a country, we are very poor in health promotion. Once we do health promotion, it will reduce our health expenditure. And secondly, it's also very, very important that we look at things that are low-hanging. The aspirations of the government, as enumerated by my sister, are enormous. We may not be able to deliver all of it. The government may not be able to deliver all of it. So therefore, there's need for prioritization. And in this prioritization, it's absolutely important to prioritize primary health care, coordinate with the subnational governments. This is a function of the subnational government. The national government needs to give technical assistance and technical support and policy guidelines, and also set up mechanisms for accountability across all levels of healthcare. The last two things I want to raise in respect to primary healthcare strengthening and holding ourselves accountable has to do with healthcare providers, ourselves. Sometimes we are the weakest link. The attitude of healthcare providers is absolutely appalling in most cases, particularly at primary healthcare level. How do we motivate physicians? How do we motivate healthcare providers to feel that they are these special people that God has created and has given us the tools for life and death? So we have to find ways of motivation. I don't know, probably we have to get our best psychologists and sociologists to give us blueprints on how to change the attitude of healthcare providers. The final thing I want to raise is the issue of what my sister, Dr. Salma, has said, human resources for health and task shifting. Now, a lot of healthcare workers are leaving the country, and I'm so happy a lot of them are turning around. After going there, they realize that all that glitters is not gold, and they're turning around. But we need to invest in the appropriate level of healthcare. We need to look at nurses, we need to look at midwives, we need to look at training CHUs. We need to look at training health assistants and deploying them. And we need to stop all this academic craze for certificates. I, as an obstetrician gynecologist, was taught obstetrics, was taught most of the maneuvers in obstetrics by a midwife. Now people have certificates. People no longer consider midwifery as something important, while it is, in fact, the most important as far as basic obstetric is concerned. So we need to rethink on how we prioritize. Perhaps if we have, and stop all this change of names from village health worker to chiefs to whatever. There's nothing in branding. What is important is the content. How can we stay true to the content and hold ourselves responsible? And if I have my way, I will actually ask Nigerian women, Nigerian children to actually come out and demand of healthcare providers and demand of government accountability. But because they are poor, because they don't have access, they're not able to do that. But as civil society, we should hold people, we should hold government accountable. We should hold ourselves accountable. And finally, I hope that with the new, with Professor Partey, I have no doubt that he's going to take care of primary healthcare, because that was where he made his most mark in his stint as a civil servant or people's servant in Nigeria when he was head of Primary Healthcare Development Agency. So I look forward to a very fruitful discussion, and I look forward to having this report not just sent to the Minister of Health, but also sent to the governors and also presented at the National Health Council, National Council on Health, so that everybody benefits from this important discussion. Thank you very much, and I'm so grateful. I was not cut off by the bumpiness of the road.
Thank you so much, Dr. Mandara. I know I'm quite aware of the challenges that you have had in joining this webinar, but against all odds, because of your passion and commitment towards the progress of the health system of the country, you have joined and have spoken so passionately. Thank you so much. My key takeaway is, for accountability first, there should be implementation of the beautiful policies that have been put together for the health sector, and motivation and reorientation of the health workforce. So Oscar, over to you.
Thank you very much, Kachi. Still Nigeria's new administration. The panel discussion, Setting the Health Agenda, is our theme this morning, brought to you by Nigeria Health Watch and the Conversation Africa. My next question is to Professor Morenike. How are you doing, ma'am?
I'm good, thank you.
Fantastic. So I want us to focus on the issue of governance, particularly the issue of community ownership of healthcare. What is your, or should I say, what are your considerations on the plans to address the fragmentation in the health governance and stimulate more community ownership of healthcare at the grassroots? Professor Obinna made a quick reference to something along the line of, at the state level, you know, a lot of federal is happening, but what's happening at the state level? So I want to tie those two together in terms of community ownership at its various level. Thank you.
Excellent. Thank you very much for asking that question. And as if you heard me, that was one of my points here, that Obinna spoke about the need to tie down to the state. But I think for me to first start is to congratulate the team and Dr. Summers' expansion of what is going to happen. I know I'm the one tying us, but I'm going to be very fast. I think for us in the health sector, it's not just that Summer is there. It's not just the fact that there's, for the first time, a special advisor on health, but we are going to have Partey there. So we're expecting brilliance. We also do know that for many years, there's been brilliance in terms of policies in the health space, but we're looking for something different, translation of those policies into action. And I think that's going to be the hard rock, the upbeats that Sama, your team is going to, everything then governance. Like Obinna did said, and just like Oscar did reiterate, we're looking for a downscaling, but Obinna sadly stopped at the level of governance. We want to start to recognize that the community is the fourth governance. that there's something truly called the fourth governance, and the community is the fourth governance. Then you start to appreciate that you have to scale down to the community as itself. But beyond that, if you start to recognize that in African context, the community is actually the most powerful, because we are a communitarian society where things start and end big time with the community, where leadership and transformation starts with the community, where the successes of every program is community dependent. You cannot sadly minimize the investment in community in itself and all the structures. Sadly, in all the brilliance of what I've heard today, just like you noted, Oscar, it stopped at the state, whereas it should actually start with the community. And when I looked at the entire investment in that program, there's too much silence on community. But I'm grateful that there was one powerful reference in the agenda during His Excellency Professor Dr. Ahmed Bola Tinubu's campaign, where he said they're looking forward to community ownership of healthcare system. And for me, I think, like you've noted, Oscar, that cannot be a buzzword, cannot just be a phrase, because it's a whole complex system. But yet the most powerful delivery of healthcare outcomes in Africa. Without that recognition, we're going to do again another cycle of stories, another listing of edited policies. And I feel very strong and certain Nigeria has one of the best libraries of policies, but the baddest of translation of policies to action. What we're looking for and expecting from this governance is the translation. Don't even formulate any policy. What you have formulated, let's translate it and let's reap of that benefit. But once again, I want to reiterate that without a strategic approach to actualizing that singular phrase, community ownership of health outcomes, would not move any significant indices. My own analysis of the indices around antenatal care access, which is reflective of many other indices in the country, is that it hasn't moved any significant. The indicators hasn't moved greatly, but we do know that the driver of that change that we want is community. So we must invest in that community health system. And one of the things I think we should promote and should not ignore is the urban spoke approach. Once we do the urban spoke approach, that spoke would allow for the integration of all other systems that are of importance to the community. Is it the one-stop shops that are operational in many ways? Is it traditional healthcare system? Is it herbal healthcare system? And not just to forget that today we're celebrating African Traditional Day, just to put that on our table. But the hub and spoke must be made to work well, whatever stories we're talking about, such that those alternative orthodox primary healthcare modalities beyond the private orthodox or the PHC orthodox will link that. And we have examples that have successfully worked in this country. It's just to scale it up. The Abiye model in Ondo State under Governor Mimiko was an excellent story of integrating traditional birth attendants into orthodox care. Highly successful. In Anambra, I think there was investment of the government in missions care. Highly successful. In Lagos State, there's integration of traditional birth attendants into routine care. Highly successful. What we're missing is this formalization of the system and moving it from pilots, but to be institutionalized. And then you start to move in a way, people that believed in alternative systems into the health systems. But let it be driven by the government, which is one of the reasons why I love the BHCPF. The BHCPF in its original plan put a significant place with the communities driving the implementation of the PHCs. However, the way it is being implemented now is losing that grip. And that's the bane of the failures. The pilot actually, the success of the pilot was dependent on the World Development Committees driving the implementation of the primary health care. The primary health care will not work when the community has not committed. But now the implementation in real life is dropping that community word. It's something that we have to go back to. I also want to highlight that once we do this, the integration, I know the agenda is about integration, is about building capacities of healthcare workers to do what they ought to do in all primary health cares in the 74 local government in every state, and specialized care. But integration has to happen. Integration itself is a health tourism approach. It's a success for Asia. It is a money spinning industry. It is an employment opportunity. And we have to look at that. This is our own. rather than starting to try to, bring in other systems, but our own. And right now, one of the most powerful things is in scaling up indigenous knowledge, owning things your own way and selling that. That's what is unique, and that's what people come to buy. And that's what they're buying in Asia. And that's why health tourism is going there. All right. And finally, there are a few other things to talk about, but I want to end because I see our time is up. It's about local health policies. Please, want to start to reformulate or revisit these policies, let it also address the integration of local health systems. Let it address the issue of equity and access. Equity will not happen without indigenous knowledge, indigenous response, addressing what people want. Don't force us into orthodox care. There is an accepted alternative care. You must recognize this. You must institute this well. And that way it will reach people. The PPMVs. People are using PPMVs, but we're not properly empowering them to do what is right. Let the new curriculum for healthcare workers address and empower them in the most friendly way, just like Miru had raised. They're friendly, but also friendly in a way that accept indigenous knowledge and integrate it. It's a big complex thing, but it's not impossible. Finally, before I say my final word, the M&E, please validate community-led monitoring system to also be part of this monitoring for change. Please note that community ownership is a complex system, it's an ongoing process, but we have to start, and please let's make it happen. Thank you very much, and thank you. Over.
Thank you so much, man. Thank you very much for that, Professor. I know you didn't have that much time, but I think you killed it, and it's a good thing you mentioned the Happy African Traditional Medicine Day. So happy African Traditional Medicine Day to everyone. For those who do not know, this is actually every 31st of August every year for the past 2 decades. WHO Africa region has marked the African Traditional Medicine Day to honor the integral role of traditional medicine in the health and welfare of generations of our people. And like you rightly mentioned, there's likely possibly more solutions in our traditional medicine than the conventional one. But hey, I'm not a scientist, I'm just a moderator, but I do think, like you rightly said, there's a lot to look into and delve into that. Kachi, will please take a time to just go through the chat room if we can accommodate one question. But I'll cede the floor for now to Senator Ibrahim, whose hand has been raised, so he can just address this. Senator Ibrahim, over to you, sir.
Oh, thank you very much. I raised my hand because I'm actually on transit also, and I have to exit soon because I need to join a flight back to Abuja from Lagos. My hand was raised because I needed to make some little additions to what I've said, particularly after Professor Bina has spoken, to say that in the works of our committee, President Advisory Committee, the Basic Healthcare Professional Fund, we identify quite a number of issues and challenges with its operationalization now. Those issues in raised and mentions were analyzed by us, and they are part of what we have recommended for change. Particularly, even in the bill, because that was the question I was asked, it's not only about increasing 2%, but we want to do reallocation because we saw inefficiency in the current allocation across the 3 pathways. There are duplication of effort between what is allocated to primary healthcare and insurance. We need to be thinking about effective purchasing and not to duplicate, because in the health centers where you are allocating capitation for the primary healthcare center, and the same primary healthcare center, money now still go for drugs, money go for HR. What is the money for capitation being used for? So we have recommended how this should be better utilized by the states, but that's by the subnational level, to get the maximum effect from Basic Healthcare Professional Fund. So the second issue I want to underscore because of time is the issue of research you mentioned. Part of the bill that we passed that actually got to the present president for signature was the Medical Research Council bill, which will work together with across stakeholders in the research. And we tried especially to be able to address the issue of funding for research in the country, the issue of better structure and organization of research, and the issue of oversight on research. Unfortunately, that bill was not signed. I put a lot of pressure because it was passed towards the end of last administration, and it was one of those bills that was sent to the current president to sign, which he did sign some. So it's a pending bill, and I think it's a low-hanging fruit that I think we recommended also for the administration to fast track because the work has been completed. Actually, I even had a personal discussion on it with the chief of staff. Unfortunately, by the day I was calling him, he said the final date for this current president to sign bill had passed. It was a Monday, and he said that was the last day. That was previous Friday. So we are hoping the current National Assembly will repass it and will address the issue of research. Finally, I looked through the questions. There are quite a number of issues I would expect that Dr. Anas will be able to answer some of them. But I want to assure most of the questionnaires that most of these issues, almost all the issue of mental health, health technology, use of data, and I saw something about accountability and leadership. We did a lot of analysis in the committee and we made key recommendations. As some of the panelists have said, I mean, particularly Romero said, we do have fine policy in Nigeria, but it's about implementation. Our hope is that the current team that are leading the sector will be able to implement what we said. Mental health is one of the key commitments of the current president during the campaign, and it's one of those things we recommended. And I'm sure most participants are aware that during the last assembly, we passed the Mental Health Act for Nigeria, which now established a mental health fund and established a mental health department. So the effective implementation of that, we hope we start from the current with the expecting budget to be able to get dedicated fund to address mental health. But all these other issues of technology, use of data, and quality of care. In fact, we did recommend because we identified that, and something has even started on that. I had a discussion with the Minister of State within this last week of an event that happened at National Eye Hospital, and the way it's being handled now, which is part of addressing challenge of quality of care, particularly in our tertiary hospitals, and accountability to service. So on the final note, I want to say that it is our hope that all stakeholders will work together with the leadership to ensure that all the issues that are raised in the agenda for the new administrations are fully implemented for the betterment of Nigeria. Thank you. Over.
Thank you very much, Senator Ibrahim. We wish you a safe trip. And it was very nice of you to add that. It adds a bit more flesh and context and information to what was said previously. Kachi, can we squeeze in a question from the chat room?
Yes, thank you, Senator Ibrahim, and for those additional insights. And we wish you a safe trip, like Oscar Michael has mentioned. Like I mentioned, there are a teeming number of questions in our Q&A chat box, and I see Mohammed Lekki, I see Olayinka Abosede, Dr. Victor Igaro. Thank you for joining. I see you. Unfortunately, we still have Dr. Salma, and as the special advisor on health to the president in our midst. A lot of questions have also been directed to you, madam. And I don't know if it's okay for me to go ahead with the questions. I would sum it all up in one recurring health area, which is private sector integration. This has come up severally from various questions. We know that private sector, in as much as they want to contribute to the health sector, provide quality health services, they are also investing capital and would want to keep their business running. So what is the plan for the government has for adequate private sector integration in Nigeria's mixed health system? This question also can be addressed from Professor Obina's insights. So, Dr. Salma, if we can have you back on the floor, the participants would want to know what is in store for the private sector. How can private sector be further adequately integrated to provide health services in Nigeria's mixed health system? Because the question now is not whether private sector is important or not. It is established that they are important providers of healthcare. Over to you, Ma.
Yes, thank you very much. I started responding by responding online because I saw there are lots of questions. So thank you for bringing up the one on private sector participation. As you said, private sector is critical to the achievement of UHC in Nigeria and having a vibrant and performance-based delivery of healthcare services at all levels in the country. So we've already started engaging with the private sector. And if you look across all the 8 thematic areas that I mentioned, they have a role to play in all the sectors, be it from issues of governance issues and then human resources. Of course, they have critical role, delivery of services. Even at the PHC level, the private sectors are not left behind. Part of what someone raised is adoption of a private primary healthcare facilities. But also there are private sectors that deliver primary healthcare services, not necessarily tertiary or secondary level of care. But I emphasize much on the area of local manufacture and having a local context in having self-sufficiency in our commodities, health commodities, including vaccines manufacture, production of vaccines. So it's just to summarize that, to say that private sector is a key partner, and we have started those engagements. We are already working with them on looking at innovative financing mechanisms. In fact, it's their submission. They worked on that section of the Renewed Hope agenda and submitted it to us, which was adopted on the innovative financing and then use of that. They've also brought up several other issues which we are going to move forward on the waiver, tax waiver on importation of medical commodities in the countries, and also promoting a private sector partnership that will reverse medical tourism, a government to create that enabling environment and also support in establishment of a state-of-the-art tertiary and quaternary healthcare facilities, which will be managed either solely by private sector or in partnership with government. So a lot of discussions are going on. And another platform we have also given them an opportunity to work closely is their participation in all the technical working groups that exist in the Ministry of Health and those that are to come up. They are also critical in the whole health sector review agenda that is currently ongoing, and they are represented in all the thematic areas. So in a summary, this is some of the few areas I can highlight, but I can assure you that our partnership with private sector is evolving, and we are on the same page since they are involved also in the development of the Renewed Hope agenda right from the beginning. Thank you. So I try to respond to some other issues that are raised, but maybe Professor Obinna will talk about the section on health financing. And distinguished senator has also responded to some of the areas that are highlighted. I have sent some of the responses online.
Thank you very much, Dr. Sama. Professor Obinna, if we have you on the call, just one final thoughts on health financing, and I make welcome. I would introduce the next and final session. Professor Obinna. Okay, not sure he's still on the call. Thank you once again, Dr. Salma. Thank you to our esteemed panelists for the engaging conversations that we have put together in the past couple of minutes around the health sector. Health is everyone's business, and I see the interest and the passion that we are engaging on this subject matter with. To wrap it up and with his closing remarks and tie up all the beautiful conversation that has been going on today, I would like to invite.
Sorry,
okay,
I think yes, Doctor wanted to say something.
Yes, just one more. I think I will not be fair to the women and children without mentioning reproductive, maternal, newborn, and child health, even though it is an integral part of the package of integrated healthcare delivery across health promotion, prevention, and then delivery of services. But I want to mention the focus of the administration, as I said, is on vulnerable and very poor people that cannot afford. And majority of those groups are women and children. So RAMCA plus nutrition falls within that category. And the family planning is an integral part of it. Our government has prioritized RAMCA plus N, including family planning, as a major area of intervention. And it's one of the key high impact intervention areas that have been identified. So I feel I should mention that before we close this meeting. Thank you.
Thank you. Thank you very much, ma'am. Okay, this webinar has been conducted in collaboration with the Conversation Africa, Nigeria Health Watch in collaboration with Conversation Africa. So I would invite the Africa Regional Director Adejunwon Soyinka for his closing remarks. But just before I hand over to you, Adejunwon, there's a survey link. We kindly want to know what you think about this webinar. And also the webinar recording will be shared via your email addresses. And I will not go away without saying a big thank you to you for staying this long in the course of the webinar. Adejunwon Soyinka, thank you. Over to you.
Thank you very much. And really impressive, very interesting discourse that we've had since the beginning of this session today. I think my task is pretty straightforward. It's just to say thank you, and I guess I've said that already. But of course, it will be incomplete without specifically commending the quality of discourse that we've had so far. Also specifically mentioning Dr. Salma for the opening thoughts that she shared with us and for the questions that she's answered. Of particular interest is the fact that she's identified how the current administration of President Bola Ahmed Tinubu is taking health as a major priority area, and not just taking health as a major priority area, but of course also describing health as a matter of fundamental human right and also a matter of important national security. I think that's a refreshing way of looking at the health sector in the country, and I think that is really commendable. Thank you, Dr. Salma, for your time today. Of course, I also thank Senator Oluriegbe for his inputs. He's giving us a lot of insights into how the executive arm of the government can collaborate with the legislative arm of the government in terms of delivery of health priorities and in terms of achieving the priorities set out by the administration. Really rich insight that is provided, and I'm grateful that we've got him on the session this afternoon. So thank you very much, Senator Oluriegbe. Professor Obinna, of course, touched on issues around corruption and absenteeism in the health sector. You know, you can have all these beautiful plans and all these beautiful priorities and programs, but of course, if the health workers are absent, if there's corruption in the sector, it will all amount to grouping in the dark. So yeah, really insightful comments from Professor Obinna, among other points that he made in the course of his presentation. Of course, Dr. Mairo advised on the need to prioritize so many things that Dr. Salma had mentioned, kind of also talking about the fact that the administration had these 8-point thematic areas in the health sector. So it's really important what Dr. Mairo brought into the discourse, talking about the need for the government to prioritize, its plans and be able to implement them accordingly. Professor Morenike advised on the need for community involvement, community involvement in the implementation of these beautiful programs and policies that have been discussed here today, which is also very key, because without community sense of ownership of these whole plans and programs, it might not amount to so much in the final analysis. For us at the Conversation Africa, we've partnered with the Nigeria Health Watch to produce this event today, and we're particularly excited and happy that the essence of our policy dialogue sessions has been met by the kind of discourse that we've had today. Our idea of having policy dialogue sessions is to have a platform, a place, a meeting place between, for policymakers and academic experts and the general public as well, to be able to rub minds on issues of importance in a particular sector. Today, I'm of the opinion that has been effectively achieved with the kind of discourse that we've had here today, with the quality of participants that we've had, in terms of participation online, the quality of questions and comments that came from our participants. So thank you very much to everyone who's joined us from the beginning and stayed to the end of this session. And you not only stayed online, but you participated effectively by asking questions, by throwing in comments. I mean, at the last count, we've had over 20 comments and questions online, which is really, really, really impressive. Thank you very much for spending time with us. Thank you very much for being being active participants in this entire process. I wouldn't leave this floor without also thanking my colleagues at the Nigeria Health Watch and colleagues at the Conversation Africa for putting up such a wonderful event and making this a hugely successful output for all of us. Thank you, Oscar, and Nkechi Kachi also for handling the event effectively. Yeah, I've done my job now. Thank you.
Your job has only just started. Thank you very much. That is our two-time Emmy-nominated Nigerian journalist, Soyinka Adejuwon. He's the West African Regional Editor for the Conversation Africa. Thanks for those very warm closing remarks. And of course, as he rightly said, thank you to each and every one of you for not just attending, but participating actively. Apologies, we couldn't get through all the questions, but we have captured the essence of the questions, and I'm sure with time, we'll be able to act on that as well. And I think for me, thank you so much. It's been quite an honor. Big love from the Conversation Africa. Kachi?
Yeah, for me, it's thank you. We apologize for stretching a little beyond the schedule, but we can continue the conversation with the hashtag Health for All on Nigeria Health Watch Twitter handle and TC_Africa. Let's keep engaging and let's keep sharing those thoughts and ideas that will set the health agenda for this new administration. Thank you from me.
Thank you. Bye.
Thank you very much. Bye-bye.
Goodbye, everyone. Enjoy the rest of your
Stay healthy and stay safe.
Thank you. Bye.
Bye-bye.
Bye.
Bye.
Kachi, there's no item 7. There's no, okay, no, I'll drive over to meet Kachi and get my item 7.
The Conversation Africa, at least Mr. David.
This is the part I switch off my video and mute my mic.
Nice one.
Nice one. Thanks, Oscar.
Thank you so much, Kachi. It was a pleasure working with you. Have a great day.